College of Nursing at Nueva Ecija University of Science and Technology. For today, I am going to demonstrate how to use incentive spirometer. So the goal for this procedure is for the patient to accurately demonstrate the procedure for using the spirometer. And for the equipment, check for incentive spirometer. So first, let us define what is an incentive spirometer. It is a device that measures how deeply you can inhale or breathe in. It helps you to take slow deep breaths to expand and fill your lungs with air. This helps prevent lung problems such as pneumonia. The incentive spirometer is made up of a breathing tube, an air chamber, and an indicator. For the implementation, review chart for any health problems that would affect the client's oxygenation status. Next one, bring necessary equipment to the bedside stand or overbed table. Perform hand hygiene and put on personal protective equipment if indicated. Next, identify the client. Next one, close the curtains around the bed and close the door to the room if possible. Explain what you are going to do and why you are going to do it to the client. And then next, we should assist the patient to an upright or semi-Fowler's position if possible. And then, remove the dentures if they fit poorly. Assess the patient's level of pain and then administer pain medication as prescribed if needed. Next, demonstrate how to steady the device with one hand and hold the mouthpiece with the other hand. If the patient cannot use the hands, assist the patient with the incentive spirometer. Next, instruct the patient to exhale normally and then place tips securely around the mouthpiece. Instruct the patient to inhale slowly as deeply as possible through the mouthpiece without using the nose. If desired, a nose clip may be used. When the patient cannot inhale anymore, the patient should hold his or her breath and count to 3. Check position of gauge to determine process and level attained. If patient begins to cough, splint and abdominal chest, instruct the client to remove lips from the mouthpiece and exhale normally. If patient becomes lightheaded during the process, tell him or her to stop and take few normal breaths before resuming incentive spirometry. Next, encourage the patient to perform incentive spirometry 5 to 10 times every 1 to 2 hours if possible. Clean the mouthpiece with water and let it dry. Remove the personal protective equipment if used and perform hand hygiene and document what you have done to the client. And that would be all for our today's video. Thank you so much for watching.